almost 1 in 1 person I come across has a deficiency in vitamin D3. This is a silent epidemic. Yes, it is serious. In our world, there are over estimated 1 billion people and more that have low vitamin D3. For the longest time, no one's really put too much of notice on this. Even if you're at the lower level of your range, people are like, just take a supplement, but no one follows up on this. The science is real. The medical science is real. Low vitamin D3 affects people from the time they're kids, teenagers, adults, and senior citizens in many, many ways. It's not just about brittle bones. It's not just about low energy levels. Vitamin D3 is a sex hormone, playing a massive role in your overall hormonal health. Your progesterone, your estrogen, your testosterone, and even your insulin sensitivity. You will notice that in patients who have insulin resistance, insulin sensitivity, they always have low vitamin D3 levels. And by correcting that level through sunlight, through food, and mainly supplementation, because guess what? We humans have messed up our climate, we've messed up our ozone layer, we don't even have the right amount of UVB rays hitting our skin, which is the magic sunshine that helps us with vitamin D3. So yep, you're going to have to go to your doctor, kids, teenagers, senior citizens, and make sure that you supplement the right way. If your reference range is 30 to 100, you want to be at 70, you want to be at 80. You do not want to overdo it on D3 because that becomes extremely toxic to your body, especially your kidney and other conditions in the body. So you want to do it under medical supervision. You know, I'm not a fan of young kids getting a blood sample done, but in today's times with the kind of crap food we have, lifestyle, sleep deprivation, pollution, it's necessary. Sometimes you got to get your 5-year-old pricked just to check if his or her levels are in place. You do not want a child with deficient D3 growing up into a teen. Lower D3 levels in teenagers affect their moods, mood swings, their hormonal development, their growth, their height, and so many other factors. Sometimes we chase more protein, sometimes we chase more supplements, we chase all the things without looking at the basics of what the human body requires. If the human body has even the slightest deficiency of a very important vitamin or mineral, it can lead to a deadly condition and disease. Half the people are roaming around today with low energy, joint pain, and looking for more and more quick fixes rather than looking at their baseline vitamin D3 levels. The patients who come to us with critical levels, their D3 is at 5 and 6 and 7, within 10 to 15 days of starting to push their D3 up, most of their symptoms start to get better. You cannot ignore the basics. The one vitamin that most people are deficient in and it's affecting their health day in, day out is vitamin D3.